Silicosis is an occupationally acquired lung disease. It is caused by inhaling silica dust, and it leads to lung inflammation and scarring. It is an irreversible and progressive disease, but it is preventable with proper measures. It can take about 10 to 15 years to develop silicosis, but people exposed to high levels of silica dust can develop the disease much earlier, and that can cause persistent cough. It can cause shortness of breath and chest pain and weakness, extreme fatigue and other symptoms.
Some of the individuals that are most vulnerable for this disease work in construction, and anybody that is working with the material that has silica inside of it and would have to cut it to reach an appropriate angle is at risk for this.
Artificial stone is primarily comprised of mineral quartz. Quartz naturally contains high amounts of silica, and as a result, these artificial stone slabs typically contain more than 90% of silica.
We became aware of the tremendous health implications of so many construction workers and individuals in a lot of the trades that were being exposed and contracting silicosis as a result of their construction work. And with so many people in my community and throughout the city of Los Angeles that are in the building trades, that are often exposed to these now discovered health impacts, we want to make sure that we're protecting as many people as we can.
You can be exposed and not have any symptoms for a long period of time, but it is accumulating in your system, and ultimately, by the time you are showing symptoms, it's too late.
Often these symptoms can be mistaken for the cold or flu, asthma, tuberculosis, or even COVID-19. And unfortunately, there is no cure for silicosis.
Well, one of the main things that I wanted to do was make sure that people understood what were some of the things that are causing it, and a lot of it has to do with the way that they're actually handling the material.
So it's really important to use effective water controls to reduce airborne dust exposure, especially avoiding dry cutting, because it's when the stone is dry is when it creates the most dust. So it's really important to keep the stone wet when you're cutting it. Using approved HEPA vacuums, appropriate respirators, and for those working directly with and fabricating the engineered stone, using adequate PPE and respirators that can actually filter the dust can help to prevent dust particles from entering the body.
For more information about silicosis and the dangers of it, please visit EWDD, our Economic Workforce Development Department, or LA County Health Department for additional information.
This is one of those things that's entirely preventable. It is a horrible, debilitating disease that people get that they don't have to. And so really it is incumbent on all of us to do everything we can to prevent them from getting this.